I decided to go into healthcare when I was in college. I had one of my really closest friends in college had a brain aneurysm that ruptured while I was in college, and it was a pretty traumatic experience. You know, all of our friends got together and really went through that time together with his family, and that's when I started thinking, you know what, I think I might want to do something which I can be there for people in their times of trouble, when they're emotionally troubled, when their physical illnesses and everything else. So I started looking into it a little bit more, and you know, I've always been told that I really enjoy service. Whether I realized it or not, I was serving people, and so I said, well, that's something that I can use to, it's a field I can use to channel my gifts into helping other people, and also you know, really getting into their lives and impacting them in a positive way. Family medicine offers such a broad range that you can really take care of babies, little kids, teenagers, adults, on into the elderly. And so you could really take care of a lot of people within the same family and develop relationships with each member of the family. And in addition to that, you know, you see them regularly as opposed to once every 5 years when they need something special done. You see them just whether they're well, whether they're sick, and you develop that relationship, and you know, you get to laugh with them and cry with them, and you just get to know them really well and get into their lives. It's great to be able to see patients out and about. It's so nice, you know, to be able to see them in the hospital when they're in their hospital gown and everything else, and they're really sick, and all of a sudden to see them well and out in the community, and you know, they come up to you and say, hey, I don't know if you remember me, but you took care of me, and you're going to be seeing me again soon. And, you know, it's fun to be able to see them, not just when they're sick, but in their day-to-day life, and to have them be able to, you know, introduce me to other family members who aren't even there for their clinic appointments and everything else, and say, hey, this is my doctor. That's been great. And I'd moved from the Woodlands, which is quite a bit bigger than here, and I didn't get to experience as much of that. And here, just even going to the restaurant the other day, I saw 3 of my patients and I got to meet the rest of their family, so that was a lot of fun. And I get to introduce them to my wife and my kids as well. My approach to medicine is really talking to the patient and sharing my knowledge and what medical updates there are, what proven therapies are, and really coming alongside them and saying, this is what I think needs to be done. There are several ways to do this, and let's talk about those ways, and let's talk through that decision-making process so that you can make an informed decision. As I've mentioned before, it's your life, your health, your illness, and while I can share my opinions and the medical side of it, I want you to take control of your health as well. And this is going to be a partnership rather than a one-sided issue where I'm telling you what to do and this is just the way it's going to be.